We're making you over from head to toe today, and right now it's time for some toes that Christy says need a lot of help.
I've been active my whole life. I love playing volleyball, but I have this problem called mallet toe, and it's really impacted my life. I'm a teacher, so after teaching all day, my toes tend to stiffen up.
This one, I have to pull on it because it's turning in like that and it needs to be straight. And then this one, I just pull on them to like kind of stretch them because they won't bend up. I had surgery in 9th grade to correct them, but it actually made it worse and they're more painful. I would describe the pain of my mallet toes as kind of a dull pain, a constant pain. It's so hard for me to find shoes that fit. I used to wear socks with my Birkenstocks. I wore tennis shoes with my prom dress, and I wore flip-flops to my own wedding. After the surgery, I'm really looking forward to wearing shoes that fit and feel comfortable and just not having to deal with the pain anymore.
Well, Christy had a procedure with podiatrist Dr. Ali Khosroabadi that will hopefully correct the problem once and for all, and we got footage.
Going into the surgery today, I'm a little nervous, but I'm also really excited that my toes will look normal and I won't be in pain anymore.
This whole operation is going to be under a fluoroscopy, meaning live x-ray. So we have a quick picture of her foot right here. The tip of the second toe and the third toe are bending down, and on the third toe it's bending down and to the side. So our goal is to get those all straightened out and put a pin or a screw in there. She's going to be having the minimal invasive surgery, and I'm going to operate right through here to fix her toe. So we're using a side cutting burr where it's going to take out some of the bone, and that would allow me to straighten out the toe. Okay, so after taking out the piece of the bone, now you can see how the toe can be straightened out in this position. So if you can look at that x-ray, you can see a piece of bone taken out. So basically, we just put the guide wire in there. Then I'm going to drill it and put a small screw right over this, and that's going to hold the toe in this position. Okay, so we are down to the point that we're going to put the screw in, and we measured, and we're driving the screw into the toe, and I'm going to drive the screw in, and that will hold everything together till it heals. So the last screw was put in, the third toe is straight, and we have 3 screws and 3 digits. The deformity should not come back. So she did really well, and she's going to be walking tomorrow.
Please welcome Dr. Khosroabadi and Christy to the show. And before we go any further, I just can't believe the reaction on all of your faces. Christy's here, she's okay. She's okay, right?
Right.
And it was worth it because I'm going to show you Christy's toes before and then after that delicate procedure. Voila! So, Dr. Katie, let's walk folks through some of the more common toe problems and then what you did for Christy and her mallet toe here. So, some common toe conditions.
Correct.
Show us what we're dealing with here.
Yeah, so we have 3 different toe conditions. We have the mallet toe, hammer toe, and claw toe. We call them mallet toe because the deformity or the contracture is at the tip of the toe. Only one joint is involved, and the tip of the toe starts basically contracting down, just like Christy's foot.
Bending down.
Bending down. And hammer toe, there are 2 joints that are involved, the middle joint and the tip of the toe. So 2 joints involved, we call that a hammer toe. And the claw toe is when 3 joints are involved, the first joint, the middle joint, and the tip of the toe, they're all involved, and it kind of pulls the toe back, and it makes it look like a claw.
Can you tell just by looking, or do you need radiographs sometimes to tell the difference between these 3 conditions?
Most often we can tell by just looking at it. If the tip of the toe is turned, then we can totally tell.
So you mentioned the minimally invasive procedure that you performed.
Exactly. So this is the procedure that I have come up with. Small incision on the side of the toe, 1 over here, and then 1 towards the back. And we cut the bone through the same incision. And as we cut the bone and take a segment out, I can straighten out the toe and insert a wire from the tip of the toe all the way down to keep the toe straight so it can heal in that same position.
And how long does the wire stay in?
The wire usually stays there for about 4 weeks, and then I pull the wire.
So this is old school.
It's old school, and as you can see, you look at it, and it already looks painful. And we actually call these toes sausage toes because they stay swollen for such a long time. Big incision we used to make, 3 to 4 centimeter, try to get into the toe, cut the joint out, and then putting everything back together and then putting a screw or a wire in there. These toes stay swollen for a long time. Very
and
painful.
here, obviously, great result. Obviously, they also need a pedicure, but we can deal with that later. These are not Christy's toes.
Exactly.
So you've had such a great result. Just looking at your toes, they look great. But I think the most important thing here with any surgery is functionality after the procedure.
That's right. And
that's what's key.
And Christy, we saw in the video that you've had problems fitting your feet with shoes. You wore those sneakers with your prom dress, right? So how's that going now?
Well, I was kind of squeezing my foot into size 11 shoes. I wear 12, and I was
Okay.
kind of squeezing them in, so I threw out all the old shoes, and now I have about 3 pairs of shoes. So my next step is to go shoe shopping.
Well, our friends at Aerosoles heard about your story, and they want to give you a gift certificate to go shopping for shoes to buy $1,000 worth of new shoes.
Christy, have fun shopping.
New toe cleavage. How does that
All
sound?
right, I am super excited.
Have fun shoe
Sounds
shopping.
great.
Dr. K, thank you for sharing this
Appreciate
procedure
it.
with
Thanks
us.
for having me.